Hello everyone, this is Dr. Ramya, Senior Resident, Department of Psychiatry, Sree Balaji Medical College and Hospital. Today's topic will be breaking the bad news. The primary objective of today's topic is to deliver the information clearly and empathetically while also supporting the patient emotionally and involving them in future planning. It is a mental strategy for conveying the information, dealing with emotions, the family, the plan for further care and support. Hence, breaking bad news needs planning and rehearsal in order for it to go well for both the doctor as well as the patient. So, preparation for consultation is important. The patient may be accompanied by a spouse or someone close to them. Ensure the doctor has a protected time. This may mean turning off the mobile phones and making sure the reception and the team members know that you are not to be disturbed. This might take a longer duration than a normal appointment, so it is important to book a double appointment. Usually, you need to get the patient to return in near future to discuss the matter more in detail. But do not seem to be rushed or too eager to get on. Make sure as fully conversant with the facts as possible. Facts about the case like exact type of tumor and the stage and more general issues about the diseases should be informed. This applies not to just cancer but also to diseases that fall into the category of bad news. Breaking bad news has a framework to be followed, which is called the spikes framework. So this involves setting up perceiving understanding of the patient, to invite the patient, knowledge, exploring the emotion, summarizing the care. So first is setting up for the interview. To set up for the interview, the doctor must be well informed about the facts. The doctor should ensure privacy of the patient. Introduce yourself and involve the significant others of the patient. Make the patient sit down and establish rapport with the patient. Next is assessing the patient's perception. What does the patient know? We can give open-ended questions and ask how it all started. Is the information given wanted for the patient? The information given should not be forced on them. And we can ask if they would like to know more about the illness. Next is obtaining the patient's invitation. How would they like to be told? Would they like all the information to be available, or do they want it step by step? Details will not be remembered, but the way the doctor explains will always be remembered. Next is giving knowledge and information to the patient. So explain the diagnosis in clear and easily digestible chunks. Checking comprehension throughout the interview is important. What are the other concerns at the moment? Should be a question that should be asked to the patients, and also allow some time and space for answers. Next is addressing the patient's emotion with empathetic response. So acknowledge the patient's feeling in a non-judgmental approach. Vital steps for patient satisfaction is important, and empathize and ensure future plan with the patient. Strategy and summary. Essence Spikes framework stands for strategy and summary. It is important to reinforce the plan and summarize the main parts of the consultation. Emphasize that the future needs will change and information will be available and further support will be available henceforth. Avoiding pitfalls during the interview. Do not avoid seeing the patient. Analyze the fact before you start. Ensure privacy of the patient. Be factual but also sympathetic. Always be empathetic, however personally you may feel. If the question is asked, how long have I got to live? Never be precise. Always give time for information to sink in and the opportunity to ask questions before moving on. Do not seem rushed. If the patient does not seem able to take any more, be prepared to end the consultation and take the topic again up later. Never say that nothing can be done or the patient will lose hope. If a written material is available, that might be useful to the patient. While trying to be positive, never lose the track of fact that it is a serious illness and potentially a fatal disease. Be optimistic but do not promise anything that may not be delivered. So to conclude, breaking the bad news is an important clinical skill that can be frequently utilized in the context of routine practice. Following an established protocol while integrating empathetic communication makes the difficult task of breaking the bad news more comfortable for the physician and helps in improving communication between the patient and the family. Thank you.